In today's episode, we are going over how I stay current with the physical therapy literature. Let's get going. Here's a really funny stat. This stat is for primary care physicians, but I think the same exact problem exists for physical therapists. So I'm going to read this stat straight from the journal. We estimate 7,287 articles are published monthly in this set of journals, in this article. Physicians trained in epidemiology would take an estimated 627.5 hours per month to evaluate these articles, right? So this is obviously a journal for physicians, but the same exact problem exists for physical therapists. There is an insane amount of research that's coming out on a very regular basis, right? So it's very hard to stay on top of all this. So the problem is simply, A, there's too much information, right? Tons of journals, lots of coming out every single month. We just really want to make sure that we're not missing major things, and we probably are, right? We're going to be missing stuff over the course of time. That's kind of just natural, I think, right? The other piece is that we don't want to spread a bunch of misinformation or bad information, okay? So A, either new research comes out that's going to negate what you've been doing for years, and we should know about that, right? Or just maybe alters the way we kind of apply our treatment strategies, right? That, or we're following bad sources, and some of those bad sources are giving misinformation, and then we're going to relay that to patients, and that's not necessarily a good thing either, right? So we got to stay on top of the literature and make sure you're following smart people that are not spreading misinformation. The other piece is that physical therapists are already overloaded, right? We're seeing 40 patient hours per week, doing a lot of notes on top of this. If you have a family, if you have other things going on within your life, just super hard to actually read literature on top of what you're already doing, right? You don't make money by sitting down and learning, which kind of stinks. Physical therapists have very little incentive to do advanced certifications, right? I got my OCS, and what did I get for that? I got a high five, right? That was it for myself, not even from anyone else. My boss didn't give any more money. If you do a fellowship, are you going to make any more money? Probably not. I mean, some companies out there maybe give you a little bit of a bump, but it's not like you get an advanced degree and all of a sudden you're making more. If anything, it's like a negative incentive for an employer to hire you if you have way more knowledge and experience, just because they probably have to pay you more. And for a new grad that has very little experience, they can pay you less. But I tell you what, insurance companies reimburse you exactly the same. So that becomes a really big problem. But at the end of the day, we want to do a good job for our patients. We don't want to be terrible physical therapists, all right? We don't want to spread misinformation. So we want to know how we can stay on top of the medical literature, the physical therapy literature, right? And still stay sane, make this a part of our regular weekly, monthly habits so we can be better clinicians at the end of the day, right? So in today's show, I'm going to go over my solution, what I've done over the course of time to try and stay relevant. I can't say this is necessarily the best way. It's just something that's worked really well for me. I'm going to go over 6 keys here, right? So number 1 is going to be skimming relevant journals. Number 2 is going to be deep dives with current patients, okay? So certain pathologies. So someone's dealing with a rotator cuff tear, and we want to try to rehab them appropriately. Probably good to check out the research on rotator cuff tears. Next, following relevant keywords on PubMed. Number 4, following relevant researchers and clinicians. Number 5, sharing the information you've learned and teaching that information to others, right? We have to make sure that we're fully understanding the information that comes in and we're able to apply it, right? And really master it. One of the best ways to do that is through sharing and teaching. And lastly, you just got to schedule time to learn, right? When's the last time you got in phenomenal shape just by winging it? You need to come up with a plan. You need to schedule the time to get to the gym, okay? You just have to. That's part of it. So before we get going, I want to let you guys know about the Fitness Pain-Free Mini Course I've made. If you like what I do and you want to take that next step, this is it. It's 100% free. I go over a bunch of different lessons. The first lesson is how traditional schooling has failed us. So I'm a physical therapist. I have a doctorate in physical therapy, 4 years of undergrad, and it was great. I learned a ton, but I did not learn how to work with folks within the gym in order to get them out of pain and back to training and keep them that way for the long haul. So in some ways, PT school is phenomenal, but just doesn't grant you the expert status that most people want, right? Next, we go over 7 reasons why people get hurt in the gym. I'm a big believer in knowing why folks get hurt, because if they get hurt, right, we can get them out of pain. But if they go right back to that same exact environment, they're just going to get hurt again, right? So we have to understand how people get hurt so we can get them back safely. Next is 4 simple steps to getting your clients out of pain. Number 4, how to build the career of your dreams and earn the respect of your community. Let's be real here. Everybody wants to be an expert working with strength and fitness. But let's say you're extremely smart and knowledgeable, but you're not working with anyone in the strength and fitness realm. That's terrible. We have to learn how to get these folks through the door. And lastly, I just want to talk a little about the fitness pain-free certification. If you want to sign up for the mini course, I'll put a link in the show notes. You guys can definitely check that out. You'll automatically be enrolled in the wait list for the fitness pain-free certification, which actually opens up very, very soon. I'm pretty pumped about this. It's going to be opening for the next cohort in January of 2023, so just in a couple weeks, right? This launches quarterly for 1 week at a time. It is the exact certification I wish that I had as a physical therapist when I first graduated. You'll gain complete confidence, work with injuries in the strength and fitness realm, learn optimal technique for both health and performance from myself and some of the best coaches in the world. I do coach, yes. However, I'm not the best coach in the world. I brought the best coaches in the world on to teach you exercise technique. You'll master programming for rehab and injury prevention. Programming, strength and conditioning is one of those things I feel is sorely lacking in the physical therapy world. I'll teach you how to do it. You'll have fun earning 31.5 CEUs for PTs and PTAs. You get a university education in working with injuries in the weight room, and then really filling your day with the patients you love working with. So like I said, I mean, we can be really, really good at working in strength and fitness, but if 90% of your patients are geriatrics, it's still not fun for you. Let me teach you how to actually blow up your schedule with a bunch of people you love working with, okay? So next cohort starts in 2 weeks. If you want to go on the wait list, go to the link in the bio, sign up for the mini course. You'll automatically be enrolled. Once you're enrolled, you save $300 too, and you get access to the certification 1 week early. Pretty cool. All righty, back to the topic today. Number one, Skim relevant journals. So first and foremost, I think it's important that you have a bit of a niche that you specialize in, okay? Now, do we need some broad knowledge sometimes? Yes, of course. And that's the reason why something like an OCS is really, really nice. However, there's too much out there, okay? So I think it really behooves you to pick a niche, right? For me, it's kind of sports physical therapy, although I tend to work with mostly strength and fitness. So for me, it's kind of sports as it pertains to, let's say, Olympic weightlifting or powerlifting, right? And some of the journals I really like to follow are Sports Health, International Journal of Sports Physical Therapy, the British Journal of Sports Medicine, American Journal of Sports Medicine, the Journal of Strength Conditioning Research, as well as JOSPT, right? So you got to find a couple journals that you really like, and then on a monthly basis when they come out, start reading through them. Okay. The next piece is that I do a lot of skimming, right? I know this is not the best way to take information in when you're reading a research article, but there's simply too much, and a lot of it's not relevant. Okay. So for me, if I'm reading Sports Health and it's talking about cricket athletes, I don't know how relevant that is to me. All right. But if I am looking at the Journal of Strength and Conditioning Research and they're starting to talk about squatting and its relevance to pain, right? All of a sudden I'm like, ooh, that perks my interest. I'm going to go in there and I'm going to read the whole thing, right? And sometimes I get halfway through the article. I'm like, no, this isn't relevant, right? Because you only have so much time. There's a lot to get through. So what I recommend is all of those journals that we just talked about that are relevant to you, skim them, right? So look through all the abstracts, read through them all, right? I sometimes don't even look at the abstracts. If the title looks like it's nowhere near my wheelhouse, I don't even read it, okay? Once you go through that abstract, if it looks relevant, then you go ahead and take a deep dive, okay? Because oftentimes we jump to conclusions about articles without actually reading them through. And there are biases that come through with the abstracts, and sometimes the methods are a little bit funky, and you're like, well, this doesn't really answer the question that the authors were talking about. So I do think it's important that you dive into those journals that are relevant and read through it, okay? And oftentimes I'm not going through all of it. Maybe I'm just reading through the methods section. I want to see the specific populations, right? There's parts of the articles I think are going to be much more important than others. And over the course of time, I think you could get pretty good at knowing what's relevant and what's not, all right? Number two, take some deep dives for your patients. What am I talking about here, right? So what are you treating at the moment, right? For me, I had a patient the other day, came in with an ankle injury. It was a bit of a weird one. It was a high ankle sprain, right? And, I've read about high ankle sprains in the past, read through some research journals, but I was a little rusty, right? Went through my tests, dorsiflexion, external rotation test. I did a squeeze test, right? Palpated those ligaments that put the tibia and fibula together, right? They were a little tender. I was like, I think you have a high ankle sprain, right? But I was a little rusty on the treatment. I was like, okay, well, it's been a while, right? It's been like 6 weeks. And at this point, you don't need to be non-weight bearing. It looks like you're making some progress. I can kind of push some of my kind of rehab stuff that I remember that's important, but After I finished up with that patient, I went and I looked into the medical literature, like what is relevant, right? What have I missed anything, right? Was I wrong about something? Should I have told him that you need to go to the doctor and go get in a boot, right? Luckily for me, it wasn't the case. And funny enough, at the end of the day, there wasn't more research that was guiding my, clinical reasoning or my treatment whatsoever. I actually kept things exactly the same. But it was nice because later on, if I had missed something, I can go back and say, hey, I think we need to go back and change this. I was looking to the medical literature, blah, 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 blah. For this athlete, I actually ended up recommending he go back and see the surgeon because he just wasn't progressing well over the course of time, right? But what's really nice is that you learn something on the spot, you apply it on the spot. The patient's going to love it because you can tell them, right, that you just did a bunch of research. They love to hear that, improves their outcomes. The other part is you learn it a little bit better just because you applied it immediately, right? So your brain ends up taking that in. It becomes more relevant knowledge, right? You're just reading stuff all the time and it just all falls out of your brain a month later. It's not useful in any way, okay? It's one of the reasons why I highly recommend this one, okay? The other thing I do is I'll do deep dives on just the subjects I treat a lot of. So for me, in the strength and fitness world, the shoulder is just, always one of the top 3 areas that's getting hurt for these folks. What's the most common type of injury I see? Probably rotator cuff related pain. Okay. So what do? I do deep dives on the rotator cuff, right? If you follow me on social media, you'll see all the rotator cuff related stuff I share, right? I'm actually currently doing a deep dive on rotator cuff repair physical therapy. So essentially, when someone has a tear and they get surgery and they go to physical therapy, what are the things that are really important, right? And for me, I have specific questions, right? So I was just looking at several articles talking about how long or whether or not you should even wear a sling, right? Also, when do you start exercise? Do you want to start with early passive range of motion? Do you start at week 2? Week 6, right? When do you start apply strengthening? Can we do this very early on? Do we need to wait a longer period of time? What are the return to sport times? All this good stuff, right? So I start writing down these questions. I head over to good old PubMed and I just start searching. I look through a bunch of different articles. I go from relevant article to relevant article. I try to follow journals that I think are good, right? It's not always the option, okay? We don't have access to all the journals we like, but I try to utilize the journals I like. And I try to use the most up-to-date articles too. So the newer ones typically tend to be a bit better, right? And I do these deep dives quite a bit. Next, follow relevant keywords on PubMed. What the heck am I talking about? So you can actually log into PubMed.com. You can make an account and you can be a member on PubMed.com. And I actually haven't done this in a while. I'm not sure if you can even do this anymore. However, I used to do this in the past. So one of the things you can do on PubMed is that you go in and you sign up for email alerts when a certain article is published that has a specific keyword, right? So essentially you just plug in, hey, PubMed, alert me anytime the word bench press gets published, right? And you have a new article that's accepted that says bench press, right? Or rotator cuff. So now what's kind of cool is that you're going to get an email every time you have this keyword pop up. Just keep in mind that the amount of research that comes out related to squat, bench press, deadlift, rotator cuff is pretty enormous. So it can get overwhelming really quickly. But again, you don't have to read all these articles in depth. Maybe just skim over top of them and see what's relevant. If you don't have time, but you think it's going to be a really important article to read at some point, then you just bookmark it for later. I have a whole bookmark full of articles that's ridiculously large that I get to when I have time, right? Next, follow relevant researchers and clinicians. And again, I think this should probably be topic specific just because there's way too many people out there that are spreading information. Now, and the way I said that, I don't think comes across well because we really need experts sharing this information, right? I obviously wouldn't be doing this today if I didn't believe that, right? But there's too many people out there. You can't learn from too many folks. Early on in my career, I wanted to learn everything, right? So I was learning about TMJ. I was learning about how to rehab, post-op shoulder replacement surgery. I was looking into cervicogenic dizziness, right? I'm looking at concussion treatment. And it's good to be well-rounded, but the problem is that I would forget everything. It was just way too much information. It was crowding out the ability to learn about the patients in front of me. So I really think it's important to be topic specific. And there's a lot of really good folks out there I trust on given topics. So if you're thinking about, let's say, running, for example, my favorite folks that I follow are Chris Johnson, Tom Goom, another good one, and Rich Willie. These guys are cranking out great content, and following them via social media is phenomenal because I get to see all the new stuff that's coming out, what their thoughts are. And lastly, I take their courses, right? I just got back from a course from Chris Johnson. It was amazing. So the folks that are really good, that have a topic that you really enjoy and you want to get caught up really quickly in what the literature shows and get the knowledge that those folks have, go to one of their courses, follow them. Okay. So I recommend buying courses for me, right? So I can buy that Lamborghini. All kidding aside, if you want to fast track your career, follow the folks who are in the shoes that you want to be in. Okay. Makes total sense. If you were in the strength world, maybe you're following folks like Brad Schoenfield and Brett Contreras. These guys are constantly releasing great information. Not only do they research themselves, but they're also publishing or sharing other very relevant, good content. Okay. If you're in the baseball world or the sports world, maybe follow folks like Mike Reinold, Dan Lorenz, or Lynn Snyder Mackler for ACLs. If you like the hip joint, another thing I really recommend is that if a lot of your patients have some sort of pathology. So for me, I treat a ton of hips. Then you probably want to follow the researchers that are looking at hips, right? So Mike Ryman is a really big name in the hip world, right? I like Michael Rathliff a lot for patellofemoral pain and Osgood Schlatters. You just want to stay on top of the researchers that are putting out great content on the things that are important to you and your patients, right? And the last thing I wrote is that you have to be careful, right? Because a lot of folks out there are spreading misinformation, right? I know you guys know that. I don't like to talk crap on folks, but it's a very real problem, right? There's folks out there spreading information, and now we're spreading that to our patients. And at the end of the day, that's not a good thing either. So just make sure that you're being cautious with the people that you follow. You vet them, make sure that they know their stuff, and they're spreading good information, right? Next step, and this is one of my favorite ones and ones I'm most passionate about, is to share and teach what you're learning. Okay. So learning is more than just skimming through an article in PubMed or skimming through Instagram and then seeing a couple cool exercises, right? That, is a part of learning. I'm not trying to trash that too much, but the other part is that I can't tell you the amount of stuff I've learned and then forgotten, right? I actually have gone back into my old Audible account and looked through all the books. There's a few books there that I definitely listened to the entire thing, right? And I can't really recall much about what the book was about. And to me, that's a total failure, right? I just wasted all this time, right? So, I think it's important that you learn relevant things. What that's going to do is that you can interact with your world, right? So patients or the people around you, your colleagues, and learn that a little bit better by sharing and teaching, okay? So in the first example I already gave you is that you do deep dives with patient pathologies, and then you share that information with your patient. You utilize the information immediately to make good decisions with the person that's in front of you, improving your patient outcomes and also improving your learning, okay? You can also share with your colleagues. One of the really cool things about Champion is that when I come in and I've got something on my mind about a specific article I just wrote, I'm like, hey, Lenny, did you hear about that new article about the ACL? Turns out that 30% of patients' ACLs grow back over the course of time. And he's like, yeah, I read that. And that's pretty cool because we can have a little talk. We can see the clinical application about that, bounce ideas back and forth off of one another, and you just learn the topics a little bit better. Journal clubs are another great idea. I've been part of a lot of journal clubs in the past. I think it's really cool if you can do that and teach some relevant stuff. It's going to help out everyone else around you, and it's going to make you a better clinician too. I'm also a large, big old fan of social media, right? You guys can't get enough of me, obviously. And I share a lot of what I'm learning directly on social media. If you follow me on Twitter or Instagram, every time I read a really cool stat from PubMed, right, on a research article, I just throw that straight up on Twitter, right? I want the rest of the world to know, right? This is good stuff. So that does two things. One, it solidifies my knowledge, right? Because I have to make a piece of content and then I share it with the world, and the world interacts with it. So the world is improving, hopefully, because we're kind of raising that status of knowledge for physical therapists. And then they're also asking more questions. We're starting discussions. I'm learning it more and more. It's really good stuff, right? And the last thing that I do, right, you don't have to do yourself, is that I will take this knowledge and I will turn it into a system that I use with my patients, right? And I will turn that into either a presentation, right? And you can do presentations, local gyms, maybe at a local seminar. Maybe you get lucky enough to present at some place like CSM. So you can take all that information, present it later, or you can turn it into a product, right? So I sell a lot of continuing education products, right? It's what I make half my income doing that. It's part of my career. So I take a lot of what I'm learning and I turn that directly into something that can elevate the status of the rest of the profession, right? Educate other clinicians, makes me a better clinician, and I profit off it as well, right? So pretty cool loop for me. I really enjoy my my life, I'll say, my career. It's pretty cool because I get to educate myself, educate others, and then profit off of that. So if you can make that occur in your life, I think it's going to make you a better clinician and learn these materials a bit better. And the last time, this is supposed to be number 6, not number 5, is you got to schedule time to learn, right? I almost put this as number 1 just because it is probably the most important key here, right? It's just that I wanted to make sure that you knew what I was talking about from a learning perspective before I showed you how I make a schedule myself, right? And if you don't schedule the time, it's just not going to happen, right? You get busy, forget about it. You don't do it for 6 months, and all of a sudden you have to stay on top of literature. You miss the opportunity to be a better clinician. Like, you got to schedule the time, all right? And what I have done over the course of time has changed. Early on in my career, I was a nutcase, right? For the first, I'll say 3 to 5 years out of school, but particularly the first 3, I learned as much as possible. I scheduled multiple hours every day to learn as much as I can. And that was pretty much the same thing that I was talking about in terms of like learning that I just showed you, right? But what I did is I set my alarm, I wake up, and then I have a schedule, right? 7 a.m., I'm going to learn for an hour and a half, get in the shower, go to work for X amount of hours, come home, work out, go to sleep, do the same thing next day. I just continued to repeat that, for years. And it's going to make you a much better clinician. I'm a psychopath, right? I do a ton of continuing education. I have a business, obviously. I can devote more time to this. I understand that you can't always do as much, but I think it's important that you have at least some sort of schedule, right? Like I said, what I do over the course of time has changed a lot. So I have some time in my schedule to learn Monday mornings and Wednesday mornings before I go in the clinic. And on my Fridays, I have a full day to do admin work, business work, continuing education, all my social media stuff. And it's going to turn into full days on Wednesday soon. So I actually have quite a bit of time to do learning. But the thing is, I schedule it into my regular routine and I make it happen. If I didn't do this, it simply wouldn't happen, right? So I highly recommend you do that. Okay. Oh, these are old questions. Sorry. And lastly, that's it for today. But I do want to remind you that if you want to take that next step and learn more from me, sign up for the Fitness Pain-Free Mini Course. It's 100% free, right? I'll put a link in the bio. The Fitness Pain-Free certification is also going to be starting up in just 2 weeks. It opens 4 times per year. If you want to take a deep dive, learning from me, learn everything that I have learned and experienced for the past 20 years, I've seriously tried to put all of this into one certification. I highly recommend you sign up for it. Starts in 2 weeks. If you sign up for the mini course, you automatically get access to the pre-sale list, which you'll save $300 when it comes out. On top of that, you get 1 week early access. All right. Thank you guys very, very much. I will now check and see if there are any questions on Instagram. And if they're not, we'll just kind of get out of here. All right. Hey guys. Anything? Oh, what's up, guys? Someone wanted to be in my live. Sorry about that. Nope, that's it. Okay. All right. That's it for questions. I appreciate it. And I'll see you on the next one. See ya.